How does COPD cause airflow obstruction? Imagine trying to breathe through a straw that keeps narrowing and collapsing. That's similar to what happens in the lungs of someone with chronic obstructive pulmonary disease. This condition causes airflow obstruction mainly through two key processes. First, there is ongoing inflammation in the small airways called bronchioles. This inflammation makes the walls of these airways swell and thicken due to fluid buildup and scarring. It also causes the muscles around the airways to grow larger and produce more mucus. All these changes make the airways narrower, which makes it harder for air to pass through. The extra mucus can clog the airways even more, blocking airflow. These changes are usually permanent and tend to get worse over time. The second process involves damage to the tiny air sacs in the lungs called alveoli. These sacs are where oxygen enters the blood and carbon dioxide leaves the body. In COPD, the walls of these alveoli break down, creating fewer but larger air spaces. This reduces the surface area available for gas exchange, making breathing less efficient. The destruction of alveolar walls also means the lungs lose some of their elastic fibers. Normally, these fibers help the lungs spring back during exhalation. Without enough elasticity, the lungs cannot fully push the air out. As a result, air gets trapped inside, causing the lungs to overinflate. This trapped air makes it even harder to breathe out and leads to a feeling of shortness of breath. Both of these processes work together to cause airflow obstruction. The narrowed, inflamed airways resist airflow, especially during exhalation. Meanwhile, the loss of lung elasticity causes the air to get trapped, making it difficult to fully empty the lungs. This combination results in a persistent, progressive difficulty in breathing out, which is a hallmark of COPD. Repeated lung infections can worsen these problems by increasing inflammation and further damaging lung tissue. Smoking is the main risk factor that triggers these changes, but not everyone who smokes develops COPD, showing other factors are involved. In summary, COPD causes airflow obstruction by making the airways narrower through inflammation and mucus buildup, and by destroying the lung tissue that helps push air out. These changes make breathing harder and lead to the symptoms many people experience with this disease.